the Secretary of State for Health should have been fired for at least 15, 20 things, including lying to everybody.
Did you know that he wanted the Prime Minister to fire you?
Yes, because he briefed the newspapers at the time.
Did you ever say anything to the Prime Minister that you knew not to be true?
No.
This was not meant to be Dominic Cummings versus Matt Hancock. This was a hearing about lessons learned from the pandemic. But 2 weeks ago, the Prime Minister's former aide gave such damning evidence against the Health Secretary, it did need addressing. Mr. Cummings was less vocal today, but it does turn out he has missed the deadline to provide any evidence to support his allegations. Back in the room, Mr. Hancock's grilling covered care homes.
Did you tell the Prime Minister in March that people in hospitals would be tested before they went back into care homes?
We set out a policy that people would be tested when tests were available. And then I set about building the testing capacity to be able to deliver on that.
At the centre of this is the now well-documented and distressing excessive number of deaths in care homes. Mr. Hancock claimed today that the best estimate was that only 1.6% of transmission was because of discharge from hospital. This was disputed by the committee co-chair.
The whole point that we've been discussing is that testing was not available in care homes. So isn't it, to put it most politely, a stretch of the imagination to believe that 1.2% of cases, 1.6% of outbreaks are attributable to hospital transmission?
Then there were questions over PPE and shortages or not.
The families of the 850 healthcare workers deserve to know why it was that their family members went to work unprotected.
We've looked into this and there's no evidence that I have seen that a shortage of PPE provision led to anybody dying of COVID.
Do you know what the risks were in regards to the procurement of PPE?
Yes, I knew the risk was if we didn't buy enough, people wouldn't have enough PPE.
Okay.
And thankfully, because my team did such an excellent job, we never had a national shortage of PPE.
Which is not how many NHS staff remember it, as they scrabbled for protection. And this document from Public Health England also revealed shortages. The Health Secretary added that in fact 1,500 health and care workers have died with COVID. If this is a precursor to the independent inquiry due to start next year, it only highlights the complexities. Asymptomatic transmission. Mr. Hancock said he had asked and had been told there was no evidence of this in January, and that even in April the WHO was sticking to this line.
I bitterly regret that I didn't overrule that scientific advice at the start and say we should proceed on the basis that there is asymptomatic transmission until we know that there isn't, rather than the other way around.
SAGE papers from the 28th of January do, however, say there was limited evidence of asymptomatic transmission. In terms of theatre, it was not as gripping as a fortnight ago with Mr. Cummings, but the Health Secretary was emphatic about what needed to be done in this pandemic.
Throughout this, I have got out of bed every morning with the view and the attitude that my job is to do everything I could to protect lives and to get this country out of the pandemic.
If Mr. Hancock breathed a sigh of relief after today's session, it will have been short-lived. This afternoon, Mr. Cummings said in his blog that he will publish the evidence.